Hi, I'm Grant Hogue from Boston Children's Hospital, and this is the Scoliosis Dialogues, the official podcast of the Scoliosis Research Society. We're going to start off with just a few housekeeping notes. I want to let everyone know that abstracts are open for our very first Asia Pacific meeting. This is going to be February 6th and 7th in 2026 in Japan. And registration is also open for the annual meeting in Charlotte, North Carolina. The dates for that meeting are September 16th through 20th, and that's this year in 2025. And so today on the podcast, we have a special treat for everyone, particularly if you're tired of hearing from surgeons or you're tired of hearing about research. And this is because we're speaking with a scoliosis patient by the name of Brayden Nichols. And this is a young man who was previously treated at the Lexington Shrine. And so, Brayden, could you get us started just by telling everyone a little bit about yourself, age, demographics, and what are you doing with your life now?
Yeah, so I'm currently 21 years old. I just turned 21 a couple days ago. I'm a now senior at the University of Kentucky studying architecture, and I sort of got interested in what you all are doing with SRS through just a couple of things Googling. I do research in pediatric healthcare with architecture in that sort of area, just Googling some like scoliosis research that's going on, and I came across some of the stuff that you all are doing. So it's kind of how I got interested in what the projects and all the sort of stuff you guys got going on.
Excellent. And I'll point out to the listeners that Brayden, you reached out to us because you wanted to be involved and you wanted to share your experience. And I think that's really incredible. And I hope that that's something that happens more in the future. And on top of that, happy 21st birthday.
Thank you.
And so, can you tell us a little bit about your first experience in clinic at the Shriners Hospital? You know, things like what you were nervous about, what you saw, what you remember, or what the staff did to allay any of your fears.
Yeah, so I sort of think of it in two different chunks because I was initially diagnosed, I would say prematurely before my like initial big growth spurt, just keeping an eye on my back, you know what they do at the doctors with your annual checkups. And I went to Shriners before they were in their new building here in Lexington. They had a previous building. And so I went there, I was in fifth grade, and sort of got like a very small rundown of what it could be because my curve could not worsen and I would never have to do anything, you know, with Shriners. But so after that, it was kind of just always in the back of my mind. Kind of forgot about it honestly until my freshman year of high school. So I would say I'm around 15 at this time. I hit like my big growth spurt. At the time, I was playing like varsity soccer. I was also getting started in club soccer and track and all the things. And it was a really big change at first, just because I got my x-rays because my doctor at my annual checkup, he noticed just off like the what you all do like off the eye that my spine was obviously curving. And so he sent me for x-rays. It all happened kind of quick. And then all I knew is the next thing I was off to, because I lived in Richmond, that's where I'm from. It's like 45 minutes, I would say, away from Shriners. And so we had a Shriners appointment scheduled, had kind of going in blind. I had no idea what neither any of my family, just because we had never dealt with scoliosis or what it entailed or what the treatment is or any sort. So went to my first appointment. They kind of gave us I would say the first appointment is a little difficult just because, I mean, you all as surgeons, you deal with it every day. So, but you also, I mean, at least in my experience, knew how to take it very slow, kind of reading the patient, just taking it as they're also receiving. I mean, on my end, it was sort of taking that boundary from like knowing nothing to realizing that like it's kind of serious, like, you know, getting whether it's surgery or bracing for the next like 3 years. So they really broke it down for me. I know the environment. It was also COVID, so that was really different just because it was almost like kind of like ghostly because there was no patients there. Because where they had you scheduled, you were in there while no one else was there. So you were in there in this huge waiting room by yourself, maybe a couple of families masked up. So I mean that environment in alone, it was probably the first time I was really going out since everything with COVID. So but the initial breakdown of it, they kind of just laid out what the options were, teaching us how to read the spinal X-ray because I mean, if you're not used to any sort of medical stuff like that, that's a whole other spectrum on its own, and something they didn't push, but also like encourage, like because you can go home and Google and research everything on your own, but just taking it very slowly because it's a huge process. So. I would say the first thing that he really broke down for me, my surgeon that I worked with over my whole experience there was, at the point I was at, I could either get surgery and kind of like brace for that, or try the bracing treatment to see if it would, not necessarily correct my curve, but withhold it from getting to a point where I would need surgery, and really broke down like the commitment that that takes. And what we looked at was around 18 to 22 hours a day is what I would need to be in my brace for it to really work. And just the dedication that that takes, because being in a brace from never being in a brace before, especially around your full torso, was really interesting. And I would say at that meeting, I was like, yeah, sure. Like, had no idea. I didn't even really know what it looked like. I would see the initial like shock factor was like when I first got it. Because the first day, I mean, it's kind of fun. They're taking you back to the back room, everything's new and everyone's so nice. And then you're going back there, they're scanning your body and getting it ready for the brace. I would say the really like shock factors when you put the brace on and you have to learn. I remember the shock for me was learning how to like to walk in it, because I put it on and it's like a corset. They strap it up really, really tight and all that's going on, and then you're having to like walk in it and then look in like the mirror and see yourself in it. That's really when I think they were really able to step in, especially all the nurses, everything helping me. I'm sure they go through it every day dealing with new patients of all ages. They were really good about just being there and just reading my emotions, which were probably all over the scale. I was probably crazy. So I would say that was my initial reaction to everything with Shriners and scoliosis and introductory to this whole process.
It's a really interesting point you make that your curve was kind of in that gray area where you
Mhm.
could have decided, all right, well, let's go ahead and do surgery or let's go into a brace.
Mhm.
And it sounded like you had a really in-depth and educational discussion with your surgeon. And I will
Yes.
tell you, just from my own personal experience, those are incredibly hard discussions to have. Because people will have these gray or these tweener curves, kind of between 40 and 55 degrees. And ultimately, most families don't want to expose their kid to the risk of surgery. But the flip side of that is nobody can wear the brace for you. You're the only one that can do it. And that's an incredible amount of responsibility for a freshman in high school. And so, how did you do it? Right? Like you've already told me that it was shocking at the beginning.
Yeah.
But my understanding is that you were very successful in this endeavor. So, what was your secret and what helped you to endure?
I really want to say that it was a mix of obviously like my family and friends, like a really good support system. Being there, Shriners, I mean, I was lucky enough to have Shriners 45 minutes away, so it was never too big of like a hassle to call them, or like, especially with them being my region, if we needed like a checkup anything time soon. So that was helpful, but also, really just looking at it long term, I don't even like getting a shot, so much less surgery was like a whole big thing that I was trying to avoid. And so that was like a quick like yes, bracing. But I would say really the hard struggle were the months that followed the bracing, because there's all the discussions of like, do I wear a front latching brace or one that latches in the back? And then it's like figuring out your curves and figuring out like, because I was 15, like I still grew a couple inches and like my body was changing and like gaining muscle and all the things. Like there was so much during that time period that was just a lot of t like change. And obviously like I couldn't even drive. I didn't have my license. So like there were just so many moments throughout that time period that I was in a brace. But a big factor for me was I think COVID helped a little bit, because I mean we were home all the time, and that's why I always tell people I think I was super lucky in that aspect, because a lot of people have like the social change and like wearing a brace out in public or in school and all the things, like the fears of that. Luckily for the first, I want to say year or so, I was pretty much fully home. And so got to really learn at my own pace, learn like my limits and learn like stretches and all the things. I was home for that. And I would say really grateful for that. One of the harder things for me was I was super involved in sports. And I mean, alone, like conditioning and practicing and tournaments and games, I would say a day I would be need to be out, like need in quotations around to be out of my brace at least 8 hours a day. And that obviously wasn't going to happen if I wanted to like follow the protocol. And the way my wrist was, I'm not sure how it is like the standard for you all now, but I had like a thermal reader chip in my brace, so it's not like I can lie and say I was like wearing it when I wasn't. So, and every checkup, this kind of held me accountable. Every checkup, the first thing they would hand me my folder, and in my folder it would have a graph of every day that I wore my braces or didn't, and then it would have like over time. So that really did help me keep me accountable as well. And they're really good about educating you on all of that and what you're reading, what you're looking at, and the purpose you're supposed to be in your brace that long. So there were some like difficult decisions I would say that I had to make for wearing my brace. I ended up not pursuing soccer for my I want to say it was the end of my junior year, towards the end of the my bracing, just so I could really focus. It was kind of like the home stretch. I really wanted to focus and make sure that I was in my brace however long I needed to, because at the end of the day, not having surgery was really my goal that I wanted, especially since my doctor was willing to really work with me, and sports was always something that we would come in and talk about, like the risk of being in sport and having a like scoliosis, like what did I need to avoid, what sort of like did I need to avoid tackling, all these things that I I really think that my surgeon like specifically went above and beyond, because he would come in and be like, okay, you need to avoid these kind of headers, and he would really study. I'm not sure if you all do that generally for every sport, but he would really personalize it for me, especially with any questions I would ask about the sports I was currently in and what I needed to avoid at that time. Like headers were probably something that he would prefer that I didn't really do, just because the compression on the spine, like trampolines, random things like that. So I think the what really pushed me through to be successful in my brace was just the true like understanding that I was able to get. I think it helped that I was at the age where I could like really cognize with everything that my doctor was telling me, but also good support system, people who were patient with me, because I mean that my emotions were everywhere from hormones to everything at that time. So some days I would come in mute and not wanting to talk to anyone. Some days were a little bit better, but I would say most days were not the best coming to checkups, just because it was something that I would say I'm also a little insecure about with my brace. I didn't really want everyone to know, like it was a secret that I tried to keep and wear as many layers as I could of clothing. But I'd say towards the end, I got more comfortable with it, and what I really put a lot of my attention to is when it got a lot more comfortable for me to talk about as well.
So one of the things you mentioned, Brayden, was sports, and
Hmm.
there's a lot of variability amongst surgeons in terms of restrictions or a lack of restrictions in terms of sports. But there might be a little bit of a disconnect because you could certainly do the things that you wanted to do from a physical standpoint, but it seems that from a timing standpoint, you didn't have the time to train the way that you wanted to train.
Hmm.
And so I think that's maybe an important thing just for us as surgeons and people who take care of scoliosis patients to know that just because we tell someone you aren't restricted for a specific activity, the amount of hours we're asking someone to wear the brace sometimes may not allow them to perform at the level that they want to or practice as much as they want to. Does that sound about right?
I think it really just depends on your patient. I'm sure it's case to case. I know for me specifically, it would, at least for maybe from a surgeon standpoint, kind of asking in the initial startup of going like the decision between like the brace or surgery, to really have them evaluate like their lifestyle, and like what their requirements are in their day-to-day life and what they do already. Because I think, especially from a patient coming in, like after the first visit, I initially understood that like there was going to have to be some give for there to be overall success, especially for the way I was living at the time, with traveling every weekend for soccer and being on two different teams and initially like starting track and like just different ideas, understanding that there might be maybe not a full, like your life doesn't have to end right there just because you're starting your brace, but there might be some things that you have to give into. So for me, I know for the first, I would say the first full year that I was in my brace, I did all the soccer things. Maybe didn't do exactly everything, but I know there were definitely some things that wore me down over time with my brace that I eventually just stopped the sport overall, with other things involved. But there were just some things like wearing my brace. I wore an undershirt, and that undershirt left some pretty bad, like I wouldn't say bruising, but red marks everywhere, just kind of where it like crunches up. I remember though, like that pain is a different kind of pain, especially taking off the brace. And there was just a lot of things that I think at the time, and I was just so sore, especially from track. I started doing like jumping, and I was doing like long jump and triple jump. So I think I was just putting too much on my body while I was also trying to like, in a sense, heal my body. So that kind of played a part in the decision. I kind of talked to my doctors as well, and they were like, maybe you just take like a month off and see like how your body feels. And I think I ended up doing that, and it was a big change. And I was okay. I would much rather long term help the health of like my spine since I had already given so much into the brace. It was a lot of encouragement from the doctors to like power through, I would say, and really everyone at Shriners. So I think, yeah, there it really just depends on what the patient is willing to give into, and there were definitely things that I had to give up over the time that it was in my brace, but I wouldn't have gone back and done it any differently just because of the outcome that I ended up having.
And so when you and I first spoke, we talked a good bit about the fact that you are in school to be an architect,
Mhm.
and one of your interests, your focus is on kind of hospital and clinical space architecture. And so how did you get into that? And did your scoliosis journey play any role in that?
Yeah, so I originally came into my undergrad focus with I think it was like a major in bio, sort of pre-med, maybe trying out some different facets of like fields in that world. And I would say pretty early on, I realized that especially with like looking at the clinicals I would take and the practices, like I'm terrified of like needles and blood, and that's I would love to do practice, and that was just not going to be for me. But I think that the world generally still had like interest to me, and I was in my freshman year, my first semester, taking a communications class, and it was kind of just general like terminology and all sorts of things in the healthcare world. And we did a little section on healthcare disparities. And in that section, it was talking about sort of in the same way there's like food deserts, there's also like hospital deserts in the like United States specifically. And that I had to write a paper on it, and it got me thinking like how lucky I was to have Shriners only 45 minutes away. Because I know some people who had different like pretty like orthopedic things that they had to drive to like Ohio from Kentucky or Indiana or like kind of far away. And that at that same time I was looking into applying for our architecture school. And so those two roads kind of just like verged the same point where that peak of interest in me applying into architecture. And in my like initial meetings, I was kind of talking to the people at admissions, like what are some of the ways I can take this degree and like where can I go with it? You know, looking past my like graduate degree. And they were like, told me all of them. The one that stuck out to me was healthcare architecture. And I thought that was super interesting because I never thought about like went behind building hospitals and all sorts of the factors that play into that and the people that go into designing them. And from there, I started architecture school, beginning of my sophomore year. And as soon as I started, I joined, I got into like a research fellowship and that I had applied to when I was pre-med, but it's for all disciplines. And so I had to change my research because I was originally doing research at the College of Nursing with some different health interventions. And so I switched, got a new mentor in the College of Design. Her name's Lindsay Fay. And it just so happened that her primary research was in healthcare design. So I got to look at some of the stuff that she had been doing, learn about all the stuff that she had done. And my first introduction was I did a semester of research in the NICU here on campus at the University of Kentucky. And I looked at sort of incorporating patient design with, or patient like design with family design. Like, how can I have both of their treatment in the same place? And I was like, oh, that's so easy. And when I did my site visits and all the research and literature review behind it, I realized how much conflict there was. And like with the patient, which would be the NICU infant, you really had to look into like light, sound, visibility for the people taking care of the baby, and all those things that maybe necessarily wouldn't go with treating the family right next door because the bathroom, the flushing of the toilet is loud, the TV that might be in the patient in the family room. So I really worked hard to like create designs that all propose like layouts as far as blueprints to incorporate the mother at least somewhat close to the NICU baby that would be treated. And from there, I ended up getting a summer fellowship that summer after. And that's sort of the most recent research that I just finished, and it is where I got to work with Shriners. And I worked with Shriners, got to do site visits, and did some data observations. Got to shadow through all the different departments in Shriners. It was really cool because I had been through all these departments as a patient, and now I was getting to shadow and go through like the behind the scenes and just hear from all the people who were there working, all the nurses, all the surgeons, and see their point of view. Like, okay, they're about to go into meet with this patient. What are they looking at? They're looking at the charts, and when they're reading like the X-rays, all the sorts of things. It was really cool, and so I got to hear from them and like what they needed day to day and all their different stations and the amount of space they would need. And then so I got to take that and learn about healthcare design through like firsthand observation. But also, I focus primarily on positive distractions in like pediatric areas and waiting rooms. And that really just means like anything that's in a waiting room that might either actively like engage a patient while they're waiting to later then have them still engage while they're talking to their like practitioner or surgeon. And I know from my experience that was super important to understand why I was being treated and what I was being treated for, so that kind of played a role in that, and also looking at how overall like mental health and emotion, because a lot of patients who are coming might be stressed about their treatment or overall just have a negative experience with it, not because of the treatment itself, but just because of what they're going through. And any way to incorporate, I used biophilic design, which is really just any component of nature that could positively affect emotion with the patient. So that was really cool, and I got to use my experience from Shriners and treatment with scoliosis, and just understanding in general, being a like pediatric patient that's being treated for something, and how I could use architecture and healthcare design to really positively affect that sort of environment. So that's how I got to really incorporate my major with my scoliosis experience.
Brayden, that's incredible. And it's something that I am pretty sure most people in your position won't be able to do, right? Like you can access kind of core memories of treatment, of being in a facility, of knowing how you felt, and be able then to, access that into your design. And so I think that's pretty incredible, and I think that's worthwhile. I've got one last question for you. And really, it's probably the most simple, but also the hardest. What would you today at 21 tell your 15-year-old self
Mm.
in terms of starting this? Whether it's the day of diagnosis or the day you get your brace, what would you tell yourself or another 15-year-old, another freshman in high school?
Yeah, I think it at the time I was going into it really stubborn just because it was one of those things like I knew it was happening and I knew it was going to happen. Being in my brace and having to wear it eventually in public, so I think going in, I would just be very upfront and honest with what is going to happen and what the process is going to look like. And I think I would just tell myself, like, obviously, like, look at your two options. Because for me, I mean, I was lucky enough to even have options, and I'm very grateful to see that now. But at the time, I was kind of just like, whatever about it, but I am very grateful that I had the option to have bracing because a lot of people may not have the option and they might be told that they're going straight into surgery without even really getting an option in that. So I am grateful for that, but I think I would just tell myself that it is going to be okay. Like there's life after your 3 years of bracing, and people are going to be a lot more reasonable, and you're not going to sit there and get made fun of because you're braced. Like people are going to be a lot more um honestly, and I think I would just tell myself also that like don't mistake like people's curiosity about your treatment for them being like maybe rude or anything or like snarky about it, because a lot of people just, I mean, just like myself prior to this treatment, I knew nothing about scoliosis or what a brace did or what it even was. So if people see like, I know for me, like my worst fear was someone seeing like my brace stick out at school, like see like the little like curve of the plastic sticking out around my shoulder or something. And when people would ask me about it, it was the end of the world for that day, and I needed to pack it up and go home. And I think it's just because I was so scared that like what people would think or anything. And looking back now and talking to my friends about it and all those sorts of things and reflecting on my experience overall because I'm far enough out from it, just people just want to know, and a lot of times especially your friends, be very open with them about it because there might be days when you are in a lot of pain and you might like be pretty negative or like kind of down that day, and if your friends like know obviously what you're going through and the extent of it, they're able to be there for you a lot more. And I think it definitely depends on like what age you are going through this treatment at, but just it's hard getting over that initial hump of going through it and being okay and sort of accepting that you're getting this treatment and all of this sorts of things, but just being learning to be open about your treatment just because in the long run it helps you so much. And I know for me, something that where I was so closed off for my treatment for the longest time, it really did almost affect my treatment a little bit because towards the end of my experience, I ended up having two braces overall. And I probably did need a third brace because at the end, my brace was way too small just because where I was growing at that point, and it was causing a lot of pain. But I wasn't comfortable enough really talking about my full experience to an extent yet to like whether my parents, friends, like surgeons, whatever it was, that I could have ended up maybe alleviating some of my pain a little bit by getting a third brace there at the final stretch of that year. So just I would just tell myself at 15, just take a couple weeks, whether it be to understand and really get comfortable with like who you are and like what you're going through, but eventually just understand that like people are gonna ask questions and it's because they want to help and they want to understand and they want to be there for you in the long run. So I think that's something that's super important for people to hear.
I love all of the things that you just said. The things that I heard were, it's going to be okay to advocate for yourself, particularly, if you need a third brace or not.
Hmm.
And that as far as your friends go, other people, that curiosity doesn't imply judgment. That more
Hmm.
often than not, it seems like your friends wanted to be there for you and help you out.
Yeah.
Well, that's excellent, Brayden. And I think that's the perfect ending. I really appreciate you being here with us on the podcast. I appreciate you sharing your story. It's a testament to your own perseverance, really more than anything. But I think we can also draw this as a win for the Shrine and for kind of the membership of the SRS, that there are a lot of people in this country and in this world taking really great care of patients and trying to encourage them to do everything they need to do to either avoid surgery in your case or have the right surgery at the right time in the safest way possible.
100%. Yes.
All right, thank you. That's all we've got today on the Scoliosis Dialogues. We will see you next time.